government is recalibrating its vaccination target to achieve what it calls population protection. Instead of inoculating 70 million adults by year's end, the health department says it is now eyeing 50 to 60 million. We now go above and beyond the headlines with Health Undersecretary Maria Rosario Vergeire. Yusek, maraming salamat po for joining us. Is this recalibration because we'll be short of vaccines to reach 70 million by the end of the year?
Actually, the goal still would be herd immunity, of course. Pero we need to understand, because of the global shortage of these vaccines, we need to recalibrate our efforts. And this 50 to 60 million would be the one which is more feasible right now and would provide the protection that we need for the population.
So when you say a shortage in global supply, this estimate of 50 to 60 million, is this final or could this estimate, Yusek, still go lower?
It will depend, no? But for now, we are seeing that the committed or the negotiated vaccines are forthcoming, meaning we have received commitment that the supplies are coming already by June, by July, and the following month. So hopefully by the end of the year, we'll be able to cover as much of the population that is needed. And the estimate right now would be this much of 50 million to 60 million Filipinos.
So that will be, with the negotiations with all of these drug manufacturers, about 100 to 120 million doses, Yusek.
Yes, actually, sir, the estimate would be 148 million doses and even more if all of these negotiations will push through and if the supplies in the global arena will be enough and sufficient for all the countries needing this.
So will this recalibration, Yusek, mean that the government will refocus vaccinations to NCR Plus, or will it be a different strategy?
Actually, the recalibration has nothing to do with our prioritization framework. The prioritization framework still, our main goal or main objective for now, the short term, would be to cover as much as the vulnerable population. And this would be the A1 to the A3 because this gives us the tangible effects like lessening hospitalizations, lessening severe disease, lessening deaths. Now, for the other sectors of the population, this is where we go and expand in the coming months so that we can be able to provide or protect more of the population as needed. So ito po yung sinasabing, when we recalibrate, we try to focus on the more affected, more dense population, more populous, so that we can be able to have more tangible effects. And we are still going to prioritize based on the criteria that we have right now.
Okay, the more dense populations, Yusek, is Metro Manila, you have Metro Cebu and Metro Davao. And when you say population protection, Yusek, is this for the whole country? Or could some areas, like the areas I mentioned, NCR Plus, Davao, and Metro Cebu, already attain herd immunity by the end of the year?
Actually, I'd just like to say that yung herd immunity kasi, this is an epidemiologic term. So when we talk about that, you are going to cover as much of 70% or maybe more of your population. When we talk about a specific area, like for example, Davao, we cannot say that we can attain herd immunity and then they can be protected because our borders are porous, interzonal. So what we are trying to achieve right now is for us to be able to cover the vulnerable population, lessen our hospitalization, lessen our deaths, lessen those with severe infections, and of course, cover as much population so that we can reduce the number of cases.
All right. 50 to 60 million by year's end. When do you think, Yusek, will we be able to reach 70 million inoculated kababayans?
Well, there is this moving target that we have right now because it's dependent on supplies, as I've said. So for now, our target would be that we reach about 500,000 jobs per day so that we will be able to reach this target of about 50 million by the end of the year. Now, reaching the 70% or even more would be maybe by 2022.
By 2022, is there a certain time? I know it's a moving target, but I was talking to Dr. Tony Liachon, and he said we can only achieve herd immunity by the end of 2022.
It's going to depend really on the supply. As I've said,
That's
if you
the bottom
try
line,
to look at
the supply.
Yes, yes. If you look at our experience, when we started off with our vaccination last March, we were only averaging a very small percentage of jobs per day. But right now, we are now at 170,000 jobs per day. And the target keeps moving up. And the accomplishment keeps moving up as the day passes because the supplies are getting steady. So hopefully we have these stable supplies in the coming months so that we will be able to reach these targets. And hopefully this herd immunity will come to fruition by next year.
And of course, everyone is keeping our fingers crossed that these negotiations with all the top vaccine manufacturers will continue. So all eyes are on the vaccine czar, Carlito Galvez, because we just have to continue to inoculate the population. This is not just a first round of 2 jabs. There could be another second or third round of jabs because we also do not know, Yusek, when this pandemic will really end.
That's right, sir. And the vaccine czar is really doing his best, and we commend him for all of his efforts. But I think he's doing a great job because we are getting more of those pre-committed supplies right now, and we have heard, based on the information that was given, that more supplies are forthcoming in the coming months. Now, as for the booster doses that we are saying, we really need to have this plan for the country wherein the booster doses will be included already in the coming years.
The booster shot, you mentioned that, Yusek. When should an individual get that booster shot when they already received their first 2 jabs? Should it be within after 6 months or after 9 months after their first 2 jabs?
Actually, we had a meeting with our experts this afternoon, and this was part of the meeting. And they were saying that there is still no sufficient evidence for us to conclude or to provide recommendations about these booster doses. Because right now, we only have initial articles, but there has been no sufficient evidence yet per vaccine that would say how long the immunity will last for these specific vaccines. So we still need to wait for further evidence so that we can complete our recommendations. So for now, the booster dosing would still not be part of the recommendations, although we need to prepare for that if and when the evidences will be here already.
In the United States, Yusek, Pfizer is already being used for kids from 12 to 17 years old. Currently, here in the country, the vaccines are only used from 18 and above. Of course, depending on the priority list. When do you think will the kids, the children from 12 to 17 years old, get their vaccines?
Well, if we base it on the Emergency Use Authority, the Pfizer vaccine that is currently in the country can already be provided to the 16 to 17 years old children or adults, adolescents here in the country. But this is from COVAX, so we can only use that for those with comorbidities. But if the FDA will have the manufacturers apply for an amended Emergency Use Authority, like for example, this Pfizer manufacturers will apply for to amend, no, and then would say in the EUA that it can also be given to 12 to 15. Then it can be provided already. But we have to think about the burden of disease among this specific population. We are seeing right now that the burden of disease really would be among the older age groups. That's why with our current supplies of vaccines, we would like to focus more on the older age groups like the elderlies, those with comorbidities, those essential sectors, before we go on to the children, because they have the least risk for contracting the disease and the least risk for from dying based on the statistics that we have.
Health Spokesperson, Undersecretary Maria Rosario Vergeire, thank you so much for joining us on Newsnight.